is Lactation Education as Advocacy, Increasing Knowledge Among Nurses. Our resource person, Dr. Vidya Sesan Ma'am, PhD, Assistant Professor, HOD, Department of Fundamental and Administration, College of Nursing, Sultan Qaboos University, Muscat, Oman. I welcome you, ma'am. About ma'am, educational and professional background. Ma'am has started her nursing profession from SS Narayana Medical School of Nursing, Kerala, and did Bachelor of Science in Nursing from MGR Medical University, Chennai, Tamil Nadu, in year 2000. Ma'am did Master of Science in Nursing from Dr. MGR Medical University, Chennai, Tamil Nadu, in year 2003. She has completed her PhD in nursing in June 2012 from Vinayaka Mission University, Salem, Tamil Nadu, and she is currently working as assistant professor in College of Nursing, Muscat, Oman. Her academic and clinical experience. Dr. Vidya Sesan ma'am has more than 18 years of academic experience in nursing profession, which includes leadership quality and strategic management, working as HOD, Assistant Dean of Training Services, clinical instructor, and many more. Ma'am has also more than 20 years of clinical experience working as operation theatre nurse and labor room midwife in Combe Women and Infants University Hospital, Dublin, Ireland, and Burami Hospital Ministry of Health, Sultanate of Oman. Ma'am honors and awards. Dr. Vidya Sesan ma'am has received Scientist Award on 2nd May 2018 from Sultan Qaboos University and Distinguished Scientist Award in Maternal Health Nursing from Venus International University in year 2017. Ma'am has also received Best Researcher Award from Sultan Qaboos University in year 2015. Ma'am has also received various certificate of appreciation and Best Publication Award for more than 6 times and ranked first among the participants. Ma'am's participation and publication. Ma'am has organized various conferences, seminar, workshop, and also been the organizing chairperson and member at different international and national forums. Ma'am has also participated and been a resource person, guest speaker, moderate in various international and nursing conferences, workshops, seminar, and poster presentation. Ma'am has published various articles, research, projects, and has several international and national publications. Ma'am has also worked as editor, journal reviewer, and been the principal investigator, co-investigator in various research projects and ongoing research. I welcome you, ma'am, and all the participants and all NTA members in this webinar. Now, without taking much time, I'm going to hand over today's session to our resource person, Dr. Vidya Sesan from Muscat, Oman. Welcome you, ma'am.
Thank you, Melisha Paul, giving a detailed introduction about me. And thank you so much. And I'm now going to start my session. So before starting, a very good morning to everyone, the participants and the organizers, and especially I'd like to thank the Nursing Teachers Association of India giving me an opportunity to have a webinar with you this hour. And I would like to again extend my thanks to Dr. Farooq Khan. He's the President of National the Nursing Teachers Examination of India, and Professor Manish Kumar, who is the Secretary of the Nursing Teachers Association of India, and Ms. Sudharani, and also all the organizing members of Nursing Teachers Association of India. And I'm going to start with the session directly. Let me share the screen with you. Okay, just a minute. Let me make it bigger. And I hope you can see my sharing PowerPoints. To start with, I'm going to talk about today related to breastfeeding. And so Lactation Education as Advocacy is my title of the talk, which I'm going to talk to you today. To make you kind of abstract. So what I'm going to talk to you today is two sessions. So the first section, which I'm going to talk to you related to the environmental effect of non-breastfeeding. So that automatically you can take it up that as advantage of breastfeeding. This is a theme which WHO has come to this year, so we have to talk about this. And the second one, which is related to myths and facts. I know that yesterday's section, Dr. Judy has spoke to you related to the myths and facts of COVID-19 and breastfeeding, but I'm going to just really going to talk about some of the myths and facts, which is very important for us to even us like healthcare providers must know about. So these are the two sections which I'm going to deal with it today. And so when we say about breastfeeding, you know that the breastfeeding is the foundation of life for everyone, because when you wanted to build on anything on your a profession, or wanted to build on your house, or anything you wanted to build on, you need to have a very good foundation, because the foundation makes makes you much stronger if you build on it. So that's why we always says that this is the first milk which you are going to have it as a food when you come out of the womb of a mom. And of course, the first food, we say that it's amniotic fluid. The first food which when you come out of the mother's womb is the breast milk. So this breast milk has, I'm not going to go again with all the things which is present in, and just to nutshell, I wanted to let you know that it has more of nutrients and antibodies and the calories which is required for the baby to grow. And breastfeeding helps space the baby. That's an important thing, because the mother needs some time to come back to pre-pregnancy stage, right? So this breastfeeding helps the mother to have a space between children, and you can concentrate on the baby more, and development of the baby, and yourself has come back to the pre-pregnancy. So that's very important. But anyway, we will talk about this later on in myths and facts, how much you can rely on it, and we will talk about it. But it has the big advantage, for spacing. And the other one, which is the breastfeeding helps us to protect from obesity. So now it's a very big concern, that worldwide. And now even in India, now the children are becoming very obese. So it may be related to many causes. I'm not saying that only the breastfeeding is the cause for it, but that one of the major cause, I can say that the breastfeeding is one of the major cause. So this can be avoided by giving them the breastfeeding in start of life. To continue with, so the WHO and experts already has recommended that we have to exclusively breastfeed for 6 months. So that is recommended from expert too. And we will see how much percentage of mothers breastfeed for exclusively 6 months. So not only for 6 months, but the recommendation is that at least we have to really go ahead with 2 years to continue after even weaning from the breastfeeding. So the breastfeeding has its advantage, as when you breastfeed for longer, that means exclusively breastfeeding. Why they have kept as this as 6 months is that this particular time period of only breastfeeding, that means you are not giving any food during this particular time for the baby, right? So this particular time period is the period of building. That means giving you a good foundation. It required a good time to get you into the good foundation. So this helps the baby's immune system to get into stronger. So to prevent occurrence of infections and diseases, especially the COVID-19, when we say about, but there is no, at the present moment, there is no connection they have done as research output that the breastfeeding has an effect on reducing the incidence of COVID-19, but it's a very big and good topic to take it up. And I think researchers have started doing such connection between breastfeeding and COVID-19 even. So many conditions we have already seen in earlier time that it can, prevent, the breastfeeding can prevent such occurrence of infections to comes to the baby and the non-communicable diseases even. Now I'm going to this year theme from WHO. So the theme says that support breastfeeding for a healthier planet. So when I just really looked into this year's WHO theme, I was wondering how the breastfeeding is really having, related to the earth and the planet and the environment. So this is a real new theme which they came up on. So I could able to really relate this with many things, and I wanted to share how the environment is going to be affected by this breastfeeding. So first of all, breastfeeding has an inherent way of protecting our earth. So how? That's what I'm going to talk to you today. You know that breastfeeding is eco-friendly. So what do you mean by eco-friendly? So that means environmental friendly. So that means there is no packing is going to happen for the breastfeeding, right? Everybody know about it. And there is no moving because this is from a mother to the baby. So that's what is going on. So how come the moving and packing is going to have effect on the environment? Because the fuel. Because we have learned so much about the greenhouse and also the the global warming related to it. So this packing and moving. So we will go ahead later. You will understand that how much fuel we are going to use day to day in life. This is a major environmental pollution factor. Considering when you are not breastfeeding. So what is next? When you are not breastfeeding, so definitely we have to go to the artificial feeding, right? So this is formula feeding. So how formula feeding is created? So we will see each one when you go ahead with that. The next thing which we wanted to look into that, the dairy farming contributes to a land and water pollution and deforestation, because when you wanted to have cultivation and farming and the cattle and things like that, so you need the land acquisition. So when you do this, I mean land acquisition, so what you're going to do is deforestation. So you know that deforestation is directly related to the environmental pollution, the carbon dioxide, which is, or methane, and nitrous oxide, which is a harmful gases which is produced from these kind of energies and this kind of farming which happens, or cattle, when we have farming and all this. So what happens, the environment is getting polluted. The carbon dioxide is not turned into, because forestation helps the carbon dioxide to turn into oxygen, right? By photosynthesis, that we have already learned about it. So this is not happening. So the environment is now full of all gases, which is again leads to the environmental pollution and global warming. And this breast milk, which you know that there is no heating required, because when you heat, So what's going to happen again? Fuel consumption is going to happen, and this also leads to more energy and heat. Also, generating heat is again is going to damage the earth by global warming. And of course, there is no preparation. It's only the preparation of the mother. First of all, the mother should know about the goodness of breastfeeding, and she should be able to, breastfeed, and the baby is ready to get the breastfeed from the mother. This is the only preparation which we need to go ahead with breastfeeding, rather than many things which we are going to go ahead with artificial breastfeeding. To again continue with that, we say that there is children who breastfed are less likely to visit the hospital. So that's a good news. That means the chemical entering into the body of these children are minimal when we compare to the bottle feeding or the artificial feeding babies. Even though we say that the drugs can control your the diseases or your issues which is happening, but at the same time these medications all has its chemical, right? So it is not good for the baby or the body as a whole when you think about it. So that you can preserve it, and it's on a very perfect temperature, and you don't have to heat or anything. So that we have already seen that the fuel or energy of heating, so it's going to be too much pollution again to the environment, and water consumption, because if you feed artificially, you need to sterilize the bottles, and so this needs water consumption. And you just really think of that every day you are feeding minimum to 8 times to 12 times, right? So when you're feeding this many times, how many these many times actually you are sterilizing the bottle if you're using the reusable. So this is very kind of, you will know how much energy you are spending for this, and it's again a global or the environmental pollution you are adding on from every house. So this is very important to just really think it over. And again, the facts or the research, when I just really gone through the researches related to the breastfeeding. So the globally, in fact, only 41% of the mothers are feeding baby, exclusively. So that means the other 59% of the mothers are not feeding the baby exclusively. So it ranges even from a month to within 6 months. So most of them, according to that research, says that most of them wean the baby within a 2 or 3 months within that time to wean. And their myths are, many myths are over there in the mothers, so that they just really go for weaning. So that's the reality. So that means people are still not aware about the breastfeeding and its content and its advantages. That is the thing which comes out when we think about it. And when we see the India as a whole, so we have only 46.4% of the mothers are exclusively breastfeeding. Even though we say that comparing to the Western world, we Asian country mothers are more prone or more towards the breastfeeding. But see, there is no much of differences if you see the 1% which the global, and also the 46.4% in India, which is more or less the similar. And the other one which we can say that, this particular 41% of the babies who need an artificial, either powder form or a liquid form, whatever the way you wanted to feed the baby, rather than the breastfeeding, that means the artificial feeding. So they have calculated, 3.8 million tons of infant formula from the factories needed. Just imagine the numbers, which is 3.8 million crores throughout a year. It's only a year which you need to, come out with. So what is needed for this particular formula feeding, and, either in a powdered form or in a water form, whatever the way you want it to. So this needs a dairy farms and cattle and a huge volume of water for these cows to clean, to feed, and all those things. And so this is again going to go for a water scarcity because the environment is already warming up, and we have no much of water available throughout the world everywhere. So we are adding on to that because we are polluting the environment, warming up, and making sure that the water is no more. So we don't know when the water is going to stop everywhere, or we are going to go with no water. So water is basically, we say that it is the basic requirements for us. Right, so we have to think about it. This is the way the environment is affected through the non breastfeeding. So when you say that non breastfeeding, so definitely we have to more give importance to breastfeeding to avoid our earth to go with warming up. So this is, we have to think it over. And another one more research which says that it is estimated like 1 kilogram of cow's milk will be yielding or giving you only 200 gram of formula powder. Can you imagine that? 1 kilogram of cow's milk. So 1 gram is equal to 1 ml. That is the calculation, right? So that means 1 kilogram is equal to 1 liter. That is 1000 gram. So 1 liter of cow's milk, you are getting only the the formula powder. It's only 200 gram you are going to get it. And for this particular 200 gram, to make it, or you can say that not 200, sorry, it is around 1000. That means 1 kilogram. 1 kilogram, you wanted to make a formula powder, it needs nearly 5000 liters. In exactly, they say that 4700 liters you need it. So see how much water you are consuming for a formula powder, and rather it is easily available within you, and you don't need any kind of preparation. Your mind, it is the major preparation, you have to really do it. So that's the only thing which is needed. So you can see that how each one of us, like each one of us as mothers, how polluting this environment together with the millions of people around in this world. And not only this particular formula or a cow's milk, this is not only the cow's milk which comes packed as formula powder. You should understand that there are many things which is added in additional ingredients in the process of milk production, which is happening, which again pollute the environment. You know that it has the ingredients of palm oil, and the palm oil is involves too much, you need a deforestation to do that. So again, you are adding to the environment, the global warming through that. And the other one is refined oils. The refined oil is too much of carbon footprint. So you can imagine that the carbon dioxide, the nitrous oxide, the methane, these are the major gases which really pollute the environment and make sure that they are trapping the infrared which comes from the sun, and trapping over here in earth and making the globe as warmed up. There is they add on rapeseed and also sunflower oil, which is highly pesticide use. Soy also, they are adding soy also. This is again forest destructions, and they use pesticides and also the a chemical that pollute the water. So water pollution, air pollution. So everything is related to non-feeding. Just a mother, if she can really think of such things. And so now it is our responsibility. I myself feel, and everyone definitely will be with me, saying that we have to really make them understand that this is only an advantage. We always speaks about advantage of breastfeeding rather than what happens if you not breastfeed. So this is very important now at the present era or present moment to make everyone understand the environmental pollution related to the non-breastfeeding. And so that's the ingredients which I wanted to let you know about. And you know that many herds or the cattle, which already we have said about, so these are very much needed to produce the milk. These cattle and producers, another one more information that you know, methane. It is again coming to a conclusion of the methane. I have read through the research. They say that it is the harmful comparing to even the carbon dioxide. This methane comes from the cattle through the flatulence. It is too much, because you need millions maybe of cattle to produce such a huge amount of you know, formula milk for these kids. It's again adding to your global warming, of course. And so they have again come to a conclusion, you know, by the research that there is, you wanted to boil the kettle. That means the energy of boiling kettles to formula feed for the first 12 months of life in the UK, they have calculated. So it is equivalent to charging almost 200 millions of smartphones. Can you imagine, just at 12 months, you know, you are using such a huge amount of you know, energy, fuel consumption. So don't you think that this is going to be add on to the you know, warming up to this environment and wasting our energy when there is scarcity of water? And of course, water is also one of the source where we get the electricity. You know about it. And to continue with that, definitely when you compare with these, you know, artificial feeding, you don't have any creation of pollution because of breastfeeding. And there is no disposal of bottles, teats, or cans. Because nowadays people prefer to use and throw. So that's the technique which they wanted to really go ahead with that. So this makes our environment again polluted, because already we are literally very you know, unhappy with the way the plastics are in and around our earth, right? So we are trying our level best in each state and country to abandon or to ban such plastic covers comes up. So when you close some ways and you are again not thinking some other ways are getting up open. So this is the plastic bottles which comes up again to the environment, add on to the you know, pollution in the earth. And of course, you know that breastfeeding helps the mother to protect infections and chronic diseases, and we have very fewer health issues. So that many of the researchers has already done research and proved it. So that is in reality. And so how it helps again the environment when you connect with that. So when you have fewer disease conditions, your admission, your going to hospital is going to be lesser, right? So this reduces again the waste from the hospitals. You know that we in many of the states, even in India and you know, abroad, but especially when you say that the Asian countries, we have lot of hospital waste. People don't know where to dump, and this also is a source of infection to the public. So we have read through many a newspaper you know, related to this in many of the states. So this again, you are adding to this by not feeding your babies and adding to the pollution from the hospital waste to the environment, of course. Sorry to before starting the myths and facts. So I think we had to really think about you know, more than what we wanted to tell when we wanted to tell the mother related to the goodness of breastfeeding. So we have to add you know, even the environment, how you are going to be keep it clear and safe for you to live in, because you are going to live in, and your generation and generations are going to live in. and you make a payment or a better place for our children to be here in this earth. So that we have to really specify while giving information to the breastfeeding mothers, not only breastfeeding mothers, to everyone who is going to breastfeed even in future, and even to even to the father, the male people, because everybody has to understand this phenomena so that it's going to really have an effect on the environment. So to continue with that, the section 2, which I'm going to talk about the myths and facts on breastfeeding. So we have many myths and facts which is over there. Most of the things which we know as healthcare providers, and but still some of us will have a kind of question comes in when somebody asks to us, is it the right or it is wrong? So just to make you understand some of the things which is we have to understand, and we have to give our best to the public in a correct way. So the first myth I can speak about today is like breast milk is not enough for their newborn baby. This is what every mother feels. So is it a fact? It is not the fact. Definitely it's not the fact. So we say that the mothers produce the right amount of milk for the babies. But like, artificial feeding, we can, we know that how much we fed the baby, like 30 ml or 60 ml, how much we have, because we could able to see, right? But breast milk, when you're feeding, you're not able to really calculate how much you have fed in each feeding. So it's not possible. We know that, but the mother should know about it, that they are producing breast milk, right amount for the baby. So why this question comes to their mind? The major thing which you all can remember when you were as a student or as a nurse or a midwife and doctor, whoever in the healthcare professionals. So when we go to the postnatal unit and we start caring the mothers, especially the primary mothers, the first question when we ask them whether you fed the baby, so they will always say that I fed the baby, but I don't think it is enough. I feel that the baby need a top up. So because now many of or most of us are educated, so they know about the top up feeding and so on. So they want to go for bottle feeding. So that's the thinking, because it is not, they don't want to breastfeed, but they think in within them that they are not producing the quantity of milk which the baby required to. So we have to give them an understanding about the scientific reason behind in that the prolactin, the hormone, we have already studied in. It's masked, it's covered in the sense that with the progesterone and estrogen, because this progesterone, especially the estrogen, is very important for coordinating the contraction during the labor. So it's still high. It takes time to come down. So it covers the action of this prolactin, so that the prolactin is the hormone which produce the milk. So it's going to be a little slower until the other two hormones wave off and say bye, and then the prolactin come into action, and you get abundant supply of milk. And it again depends on how far or how much you are feeding the baby. As you feed more, your breast milk is going to come down. So it's an action between prolactin and the oxytocin which comes up, and so there is no issue related or no thinking of whether you have adequate breast milk or not. And how can we again inform or to educate the mother related to this? So every mother thinks that the baby has to be chubby, bubbly, by looking at the advertisements and so on, and so they think that the breast milk is not going to put the baby into a kind of bubbly kind, so it is making the baby stronger. And definitely we have to make sure that the baby is getting a weight gain. So that is one of the major output which we can see over, and pay attention. The mothers have to pay attention towards the output. That means the urine and the motion, the number of times, and the sleeping of the baby. Because when the baby sleep for kind of 1.5 hours very well, so that itself indicate that you have fed the baby very well, and it's enough for the baby to have a particular time period. That means 2 to 3 hours of time. So again, I wanted to confirm this here, that this is a myth, and the fact is mothers produce the right amount of the milk. So can we go to the next myth? It says that should not feed when you are sick. Everybody has a question. Can I feed? I'm having fever. I'm having cold. I'm having some kind of infection. So can I feed? Some of the mothers would like to feed the baby, thinking the baby gets infection. So what is a fact in that is that mother has to feed really, because the antibody is formed because of her sickness or infection is going to go through breast milk to the baby, pass to the baby. So it gives more building up of defenses or immunity power to the baby, rather than not giving breast milk and going for artificial. It's not really a correct way of doing it. And so we have to advise the mother. The mother should feed if even the mother is sick. The next myth, it says that no pregnancy during breastfeeding. It's again, everybody thinks that, definitely in the beginning I said this is one of the way of contraception, giving space to children. But at the same time, you always have to advise the mother. We cannot just really give a wrong information to the public, right? So we have to really think of, there is no guarantee. So that means it's not 100%. That is the guarantee. I mean by no guarantee to really give, to them. So, but the chances of the contraceptive effect will be much more when you exclusively breastfeeding for 6 months. That you can advise them. So that is the fact. And the next myth, it is stop feeding if your baby has diarrhea. So everybody thinks that because you have fed the baby, that's why the baby gone into diarrhea, or you have had some infection, so the baby had diarrhea. So this is again a myth. So we have to see the fact that even though the baby has diarrhea, so we have to advise the mothers to go ahead with feeding. So it always protect the gastrointestinal system and helps to fight with the infection in the baby and recover fast as soon as, and then prevent dehydration. Diarrhea, definitely go for dehydration. And this is the common neonatal issues which always we face, like respiratory infections and also the diarrhea. It's very common, especially in Asian situation. So we have to advise on the basis of that. So the other myths, they say that small breast produce less milk. So this is not really the correct, because it is not the size of the breast makes the production of the quantity of milk which is going to be produced. So it is only a play of you all know about the hormones which play around. So that's the major. And the readiness of the mother with full heart. So that improves your breastfeeding, and the breast milk, to feel comfortable and feel that you wanted to really feed the baby. That itself, the thinking itself will get you into more production of milk. So that's what we always say, is that the size of the breast, and it is not linked to the the amount of milk which comes from the maternal body or the mother's body. So the next one is related to no iron content in breast milk. So every mother thinks that, hence the baby needs some supplementation. So where from this is coming? No iron is there in breast milk, because we are always advised when the mothers comes to the antenatal OPD saying that you have to have iron rich food, and you should not come down below 11 gram per DL according to WHO. So we consider that as physiological anemia, as a pathological anemia if you go 11 gram and below. Especially we always advise them in antenatal classes when they come. Tell them that the 3 months of the last trimester, the fetus tried to take some of the iron from mother's body and keep it reserved for further use. So that kind of thinking, maybe I'm thinking that kind of thinking in them, put them into a kind of myths, thinking like the breast milk doesn't have iron. That is why the baby stores iron for this, a future use for 1 or 2 months. So I have to really give a supplementation of iron to make sure that the baby has a good growth and things like that. So again, this is a myth. The fact is that the breast milk contains a perfect amount of iron for the baby's growth. So this needs to be specified when we give advice during the antenatal time itself, because breastfeeding always we start from advising them when they are in antenatal, not beginning from the postnatal. So this is one of the important thing which we can share with them. So the next myth is related to the infant formula is same as breast milk. This is again another myth which we can say that definitely not, because now we have just really gone through how it is prepared, what are the additional content which is over there, and so we have seen the differences now at the present session itself, that there is much differences when you feed the baby with infant formula and when you feed the baby with the breast milk. So the breast milk has antibodies, and you have living cells, and you have enzymes and hormones, and which protect the baby from any infections, and also the non-communicable diseases. This doesn't never have any closeness even with the infant formula and the breast milk. So the next myth is should not breastfeed 24 hours after the vaccination. So everybody has a doubt whether I can feed the baby after vaccination. And some of the mothers will stay 24 hours without the breast milk. Giving them and kind of artificial and maybe leaving the baby without even feeding, and so that kind of. So this is not literally correct. So the fact is that no need to do such things because it doesn't have any connection between the breastfeeding and also the immunization effect. So now many studies have proved that when you are giving vaccination, you can ask the mother to breastfeed so that the pain which the baby has during such an immunization procedure is much lesser. So many studies have already proved it. So that itself will let us know that it's a myth. So that you should avoid feeding the baby, soon after vaccination for 24 hours. And the next myth related to breastfeeding, they say that you need to consume milk to produce breast milk. It's not only a saying or myth. I can say that many of our even parents and grandparents always we recommend us that drink milk more, so you can get more milk out of you. It's a myth again. Drinking milk is not going to produce you to get more quantity of milk, never. So it is important. I can understand that why they are saying such, the milk to drink. They are only saying that hydrate yourself. So not with always milk. So the hydration can be in the form of any fluid, right? So it is important to remain hydrated when you wanted to feed the baby. So that's the only rationale behind it. It's not the milk you have to consume so that you produce more, milk out of you. and also healthy diet. So when we say that the healthy diet, I wanted to just really have a talk with you the topic like healthy diet. So now there are many research they have found out that the breast milk has the taste. Not only the breast milk has the taste definitely, and even the amniotic fluid has the taste of the food which we take during the antenatal period. So we always recommend the antenatal mother to have a healthy diet and a well balanced diet during the antenatal period, and also the breastfeeding time, that means the postnatal time, to make sure that your physiological changes can be helped in and the baby grow in, and also to feed the baby well. But one more thing, internally, when we analyze internally, we can understand that this taste which is over there, is going to help you later on when you start weaning the baby, because the research found out that when a mother has taken any form of like garlic or ginger, and or the carrot juice, they have done a study related, and they found out that the smell of this amniotic fluid, the others could able to understand even without knowing that what the mother had, whether it is the orange, I mean the carrot juice, or the garlic or the ginger, they could able to tell and smell and say that this is ginger and this is with the garlic. So that indicate that the amniotic fluid and even breast milk has the smell of it and taste of it. The baby when grow around 13 weeks, the baby's gut is formed, and the baby started swallowing amniotic fluid. So the baby started, taste buds are formed, and the baby had its taste whatever the mother takes, and the same like in breast milk also. So when breastfeeding is going on also, the baby tastes not only the breast milk but the food which we takes, that has its flavor, right? So the flavor goes or taste goes to the baby's system. So this is very easy to make a weaning kind, because nowadays it's so difficult, and many of us are couples are working, both are working, sharing their responsibilities at the present moment. We have a tough time, to be frank, feeding the toddlers running behind, and so they spit, and because they don't like the taste and the flavor. But when you start even from antenatal and throughout the postnatal period in 6 months of your breastfeeding, so the baby accommodate itself to the taste of whatever you are taking. That is why we always says that take variety of food, not I don't like this kind of the picking up things for eating antenatal and postnatal. Please don't do that. That we have to advise, because take a variety of food in your a pack of nutrition when you think about in antenatal and also during the breastfeeding time, so that the baby accommodate or takes that taste into, and because at home that we prepare the same food most of the days, the same continuation, same food in the sense not every day the same, but a rotation. When we say that we are in a month, most of the food which we make is the same. We like to go ahead with that. So the same thing which you are preparing the baby to have it on that particular time period when you wean the baby, and it's easy for you to make sure that you feed the baby well during, even after we breastfeeding to the weaning, and throughout the toddler and preschool and so on. This is again a myth saying that more milk in, and so that you get out of a production of milk from your body. The next myth, it says that wash your nipples before breastfeeding. And this is again a non-fact, non-fact, or you can say that the fact is you should not do that. Because what we learned in antenatal time of physiological changes, and the breast which has, or the areola which has the Montgomery's tubercles, and which secretes sebum or the oil, which makes the nipple and areola supple and soft or moisturized. So it prevents cracking, to be frank. The cracking will lead to infection to enter, and you breastfeed the baby and then the baby gets infection, right? This is to be avoided by not to wash your nipple or breast while feeding every time when you are, and anyway you are going to make sure that you are hygienic, you are taking bath daily, twice daily, and that's enough and more. And we always recommend that when feeding is get over, 1 or 2 drops of milk can be pressed out, and you can apply in areola and the nipple, so that protects infections and so on. So this is a good advice we can give it to them. The next myth is related to the breastfeeding will alter the shape of your breast. So this is a very kind of talks related to, especially nowadays young generation are very focused on their body, the shape and so on. They have a myth always in their mind: if I breastfeed, my shape of the breast is going to alter, it's going to zag, and I look horrible. So I don't want it to breastfeed to avoid such things to happen. So this is again a real myth. What is the fact? So breastfeeding is not the reason for sagging or hanging the breast. The major reason behind that, we have to go back again to the antenatal classes which we have learned. The antenatal physiological changes which we have studied related to the breast is that it is the breast changes. That means the size of the breast is changing, and it is going to be bigger in size to get ready for lactation during the postnatal. So it starts from even 5th week. That's what we studied. So as the breast is growing and it is weighing much more than the normal breast, right? So we need to give a good support. So anything which is hanging anywhere, even don't think about only breast, but anything which is hanging for a longer time is going to be sagging. So definitely that is going to happen. So you can think about it, and what advice we can give from it is not the advice which we have to give from postnatal, but antenatal, the day one, when you know that the mother is pregnant, even before that, adolescent age, we can advise them related to breastfeeding, because we have to start as early as possible, I feel, to make them understand so many things, because we cannot bombard all the informations within a particular time period. It needs a kind of sessions to inform them about the goodness of this breastfeeding. So we have to inform everyone, women, that they have to wear a perfect fitting, a brassiere to prevent the sagging breast. It is not, again, to tell them that the breastfeeding has a direct effect on the changing of their shape by sagging or the breast. So this particular sagging of the breast again contributes during the postnatal. How? During the postnatal, you know that the abundant supply of breast milk is going to come out, especially those who are feeding the baby. As you feed, the amount of milk is going to be much more. So in this particular situations, the weight again, you can see the rationale behind. The weight again is going to be much more. And many of, mothers, they think that you need not wear a brassiere, at least, when especially they are at home, because nobody is going to come into the room to see that while you are breastfeeding. But we have to advise them. It's not because we say that it's easy. It is easy to breastfeed when you are not wearing a bra on you. But at the same time, we have to advise earlier that this is also a contributing factor for sagging. So The myths comes later. If they don't know, the myths come later that, my God, I have breastfed. See my condition, it is sagging. So please don't breastfeed. So that will be the one which the mothers start to spread. So we don't want to happen that, because it's a myth, it's not a fact. And even age also can be one of the contributing factor, because a primary mother who delivers like 25 and 27 years, and a multi mother who delivers multi at the age of like 40 plus, or 36, 40, and plus. So you know that the changes which takes place when we become old, right? Because the muscles are going to be more flabby. And again, an advice to mothers, because they should not tell later on saying that the breastfeeding is directly related to sagging. It's how you are keeping yourself. That is the thing which you wanted to advise them from the beginning. That there are many exercises starting from antenatal, not only from antenatal, you can start from early in life even, to make sure that you wanted to keep up your breast shape. You have many exercises to follow a lifelong to make sure that you have a better body structure. You wanted to, if you wanted to keep it, it is your wish and will, and it depends on people again. And people should not, say like breastfeeding is the related factor. Another related one more factor is the weight gain. That also can be one of the changes which comes to the breast when you put on weight. So we can try our level best to make sure that you are not putting on weight. So anyway, the myth says that breastfeeding will alter shape by sagging, or hanging the breast. And so we come out the fact saying that no, breastfeeding is not directly. It is related to some other factors which we can have a good control over. I know that yesterday's section, Dr. Judy has talked to you regarding the feeding COVID-19 and the myths and facts, but just again wanted to reinforce a kind of reinforcement today's section, that many research has been done in Western countries and even in some of the Asian countries also, and they come to a conclusion that there is no evidence of any transmission of this virus through breast milk. So very safe. You can go ahead and advise the mother closing your eyes, saying that you can breastfeed, because there is no viruses which is going to come to your baby through you. But one thing we have to really keep in mind, because breast milk is not going to give the baby the COVID, but chances are there if you have a close contact and not maintaining the precautions which the nation has told us to go ahead with that. So that means you have to have a limited contact as much as possible, but at the same time, we need a bond between. But whenever you wanted to have a contact and whenever you breastfeed, because breastfeed is too much close contact with your baby, so you have to wear mask, and better to wear, I feel that to advise them to have a shield more than the mask, which you can, a mask and also a shield for the time being, like 20 to 30 minutes when you at a stretch breastfeed, and also wash your hands very well. So that is very important, and whatever you are using and nearby, clean and keep washed off all the birds and things like that. So this will help you to protect the baby from getting COVID, the coronavirus. This is not spreading through the breast milk, even if the mother has the virus, positive corona or positive COVID, the mother has. So that is already many studies have proved. I don't think so any more studies to come up with proving again and again. So this you can always recommend. And also WHO, we always go for their evidences, saying that, and even NICE guidelines, which is the UK one, which always comes up immediately with the evidence-based practice, which we can go ahead and we can trust on. Like women with COVID-19 can breastfeed if they wish to do so. And only thing is that practice respiratory hygiene. So that's why we wear mask and cover with your shield, and wash hands before and after touching the baby, and routinely clean and disinfect surfaces. So when we say that three W's, when we go ahead with that, wearing mask and washing hands, and also cleaning your surfaces, disinfecting and your surfaces, so you are very safe. And even they have found that amniotic fluid even doesn't have the virus. So that's also the positive mothers, they have tested for the amniotic fluid, they found out that nothing is over there. But definitely I can say that vertical transmission is possible. So many studies have proved, like 1 in 10 to 1 in 12 mothers with positive, the child's were, or the baby's newborns were positive. So it's also give you a kind of understanding that it is not 100 percentage the babies all gets. It's only a 1 in 10 and 1 in 12. So the percentage, it's very limited. So you don't have to really worry, or the mothers don't have to worry too much related to this. And to conclude, and I think I have talked to you regarding the environmental issues, which is, we can say that an advantage of breastfeeding, you can say, but at the same time, what we have spelled out, or to come out with saying that the environment is getting polluted because of the non-breastfeeding. So at the same time, we are concluding to say that the breastfeeding helps our motherland, our environment to be safer to live. We need, and because that one virus at the present moment is really making us too much in this time. We have no connections between people. We are not able to see our own relatives, and so much, that how much we are suffering from a kind of January we started, and now still we are not able to go ahead and see our own. Some of them are not able to see even their own children when they are away and in abroad. So this has to, every one of us has to take the responsibility to make a living, better in this world by contributing. So one of the contribution from our health sector is to advise the mother related to breastfeeding. It's important. And when you say that the breastfeeding is very important, I want you to talk about the formula feeding, how it affects the environment, so that they are very much clear which to go on, how to go on, and things like that. And we need to create awareness, because we always, every year comes with the theme, and every year we have all the programs for a week. And every day the health workers, that kind of, what I mean, doctors and nurses and midwives and students and all are really giving as much as they can to the community about the importance of breastfeeding. But still see the percentage of people who is exclusively breastfeeding the babies. And so that means we need to work hard more. Still we have to go ahead and work. So awareness needed to be created across society, and about the importance of breastfeeding to the benefit of mom, benefit to the babies, and benefit to the environment, especially at the moment, according to the theme. And I think I have, as much as I can and possible, I have given some information which you may know. Some of them sometimes you may not know about it. And a kind of reinforcement, I can say that, because everybody, as we as healthcare providers are very have very good knowledge related to the conditions, diseases, and so on. And we are always updating ourselves. I know about it. And so this is I feel a kind of reinforcement section to everyone. And thank you so much giving an opportunity. I could talk about the breastfeeding related. And if I can, as a person, benefit out of only one person, at least it will be a very good thing for me. And thank you once again. I wanted to thank the Nursing Teachers Association, Dr. Farouk Khan, and all the members of the society, given an opportunity, and they are making sure that even though we are not able to come close together like face to face, they have arranged such a well done seminar in an international arena to come together, many of us, and make sure that the knowledge is still imparting. And a very good salute and a thank to the organization, Professor Manish Kumar and Miss Sudharani, and thanks to Miss Milisha, who has introduced me to this particular section, and thanks to all participants who are listening to my talk for this particular 1 hour, and hope you have got some essence of my talk today. I'm signing off at the present moment, and give it to the organizers to talk on the. I can take any questions if you would like to ask me, if time permits, and as much as possible, I can give you some information, whatever I know from my side. Thank you, everybody.
Melisha ma'am,
Yes, ma'am.
there are questions in QA box. We can have that questions.
Okay, ma'am. Ma'am, it was very useful and explanatory session on breast care management. Very informative. Thank you, ma'am, for the session. Ma'am, we have some queries. My first query is, what can be the solution for working mother to breastfeed her baby exclusively, those working in private sector and does not have the privilege of 6 month prescribed maternity leave?
Okay. So this is, we can say about, Asian system. In abroad, we do have enough time, 7 months to 8 months in Ireland, and also 1 year nearly to UK and system. So I think we have to change the system again in India and Asian countries. I don't know who's going to do that. But anyway, the question is related to how you're going to tackle this situation. And of course, we have 45 days. I know that the leave which is available, and we have to go in for duty again. And you know that the breast milk can be stored. So that is the beauty of it. And we can store for hours, in the refrigerator, and somebody can feed the baby. You can keep it either in the fridge or in the refrigerator. If you keep it in the refrigerator inside the freezer, you have more shelf life, so that you can feed. And once you come back, you can even feed the baby. And another thing, you can do it if you are really wanted to feed the baby. It's my opinion. You can save it when you are coming out of your house, but you know that problem, like after 8 hours, 10 hours, your breast is going to be the milk supply is going to be too much on, and so it is better to express, somebody can be there, or your relatives or somebody can be there to take that expressed milk when the mother gives you. And definitely every sector, in offices or anywhere you are working, they're not going to prevent you such things to happen, and so you can do that. And many of the places I have seen, like some of the places even in India, they have a separate room for breastfeeding. So if the baby is so nearby, and either you can go ahead and feed the baby directly, or they can bring the baby for feeding. So there are many ways, I can say, that if this is not possible for you to move around, or the baby to move around, and then it's better to preserve the milk in the fridge, and you can heat it, and you can give the baby the breast milk. That doesn't mean that you have to go for a formula milk because you are a working mother.
Ma'am, next question.
Okay.
How many months breastfeeding can be considered as natural spacing method?
Okay. So that's why I said in the beginning that we have no guarantee. The myth says that, like when you breastfed, so you are not going to get, pregnancy at all. It is not a correct information. So again, the percentages, we can increase the percentage of, contraceptive effect when you breastfeed the baby, exclusively for 6 months. So the exclusively for 6 months, if you are feeding, what is going to happen over here is that your menstruation is going to be postponed. There is chances of follicle stimulating hormones and luteinizing hormone, which is very necessary for you to get pregnancy. So that is going to postpone as much you are going to breastfeed, because prolactin is also going to help in this regard of keeping the hormones a little bit far away. So that way, as much as possible, if you feed the baby exclusively 6 months, I feel that you have more percentage. And still, I won't say that 100% everyone can rely on this particular method. Some of them can go through, and when menstruation comes back, and it is better to add on if you really wanted to go either natural way of contraceptives, or can go for progestin, because estrogen we never recommend during the breastfeeding because it acts on prolactin and the breast milk can be production can be affected.
Okay, ma'am, last question. For a
Yes.
baby since birth to 6 months, except breastfeeding, if we give other supplement, then what are side effects may occur?
Can you once more, please?
For a baby since
Okay.
birth to 6 months,
Mm-hmm.
except breastfeeding, if we give other supplement, then what are side effects may occur?
I don't know what you mean by the supplements. Maybe are you saying that the weaning early? I am not very sure. But anyway, supplements in the sense like iron supplementation and vitamin A and all those supplementations, which is not really required. We have studied that even the supplementations, more the supplementation, there is chances of more issues going to happen rather than, because we always says that the nutrients have to be balanced when you take it, even for an adult. So for the baby just born, so we don't have to pump on all the nutrients to the baby to grow. So the breast milk has sufficient nutrients and also the sufficient supplements which the baby required for the time being. It's nature, it's God's gift for us. So I don't think so it needed. But if you have a more kind of vitamins and multivitamins and you are pumping on, so definitely the body can have some reactions to it. So that's what my answer for it.
Okay, ma'am. Thank you so much, ma'am, for clearing all the doubts. Now the time for the thanks. I would like to express my heartfelt thanks and gratitude to Dr. Farooq Khan, National President, NTA India, and Professor Manish Kumar, Secretary General, NTA India, for providing me the opportunity to moderate today's session. I also express my sincere thanks to our today's resource person, Dr. Vidya Sesan ma'am from Sultan Qaboos University, Muscat, Oman, for sharing and giving her informative and useful knowledge on breast care management. I would like to appreciate and thanks our valuable participants for attending today's session. Tomorrow we will be having our last session for the International Virtual Conference Series. I once again would like to thank each and everyone for your valuable presence. Thank you so much. Till then, have a good day.
Thank you all. Thank you so much.
Thank you so much, Vidya ma'am. On behalf of Nursing Teachers Association, I would like to express my sincere gratitude towards you as you got agreed to speak as a resource person here, and we are enriched with the knowledge you have shared today as well. And I'm sure that our participants has benefited a lot. There are many of the myths and facts that those have been cleared today. So thank you very much for your valuable time as well, ma'am. Thank you so much. Thank you, Sudha ma'am, for supporting and organizing such a nice series regarding breast care management. Thank you, Melisha, for the nice moderation. Thank you, everyone. Have a great day ahead.
Thank you. Thank you all. Have a good day.
Thank you, ma'am.